In this video, we'll discuss syringomyelia, the tracts affected, its causes, and the signs symptoms produced by syringomyelia. Syrinx means cavity. Cavitation in the spinal cord is syringomyelia. Cavity expands and causes degeneration of the tract. Syrinx or cavity may be two types. Inside the central canal of the spinal cord, or hydromelia, or dilatation of the central canal of the spinal cord, and is due to obstruction to the CSF flow. It communicates with the fourth ventricle. Interference with outflow of CSF from the fourth ventricle to the foramen of Luschka and Magendie may lead to syringomyelia. Block leads to pressure on the cervical spinal cord, leading to syrinx formation. And what's syringobulbia? Syringobulbia is if the cavity extends upwards to medulla and pons. And second type of syrinx or cavity may be inside the spinal cord but outside the central canal of the spinal cord, and it does not communicate with the fourth ventricle. What's the most common site of syringomyelia? Upper cervical and upper thoracic. What are the sign symptoms? The sign symptoms are insidious in onset and cause chronic degenerative progressive myelopathy. It begins in adolescence and early adulthood. The onset may follow trauma or neck extension. What are the classical presentations of central cord syndrome? Classical presentation are dissociated sensory loss and areflexive weakness. So what type of dissociative sensory loss is produced in syringomyelia? Loss of pain and temperature fiber and sparing of touch, vibration and position senses. Pain and temperature fibers are carried by lateral spinothalamic tract, and touch, vibration and position senses are carried by the dorsal column. What's the size of temperature and pain loss? Loss of pain and temperature sensation occur over the nape of the neck, shoulder and upper limb in a cape-like distribution. Why burns and injuries occur in hands of patients with syringomyelia? Most cases begin with unilateral sensory loss in hand, leading to burns and injuries. What are the motor abnormalities in syringomyelia? Initially, the motor abnormalities are that of lower motor neuron lesion, that is muscle wasting, weakness, areflexia and atonia or hypotonia. Which muscles are involved? Lower neck, shoulder, arm and hand muscle are involved. And what do they indicate? They indicate extension of the cavity to anterior horn. Later, as the lesion enlarges, upper motor neuron lesion occur because of the lateral corticospinal tract involvement, and that leads to spasticity, muscle weakness, hypertonia and hyperreflexia in the lower limb, and bladder and bowel dysfunction also occur. Cervical lesions at any level may cause Horner syndrome. And what's Horner syndrome? Ipsilateral meiosis, ptosis and anhidrosis. Why there is numbness and sensory loss on face in syringomyelia? Due to damage to descending tract of the trigeminal nerve, maxillary division. What are the clinical features of syringobulbia? Clinical features of syringobulbia are palatal or vocal cord paralysis, dysarthria, nystagmus, vertical or horizontal, and tongue weakness. What are the causes of syringomyelia? May be developmental or acquired. 50% of the cases are due to developmental defect of Chiari malformation. And what happens in Chiari malformations? In Chiari malformations, cerebellar tonsils herniate into the cervical spinal canal. The acquired causes are maybe idiopathic, trauma, tumor, infection, and necrosis of the spinal cord. What infection usually cause syringomyelia? Myelitis, transverse myelitis, and chronic arachnoiditis. CSF may be normal or proteinaceous. Patient may have thoracic kyphoscoliosis. MRI accurately identifies syrinx in spinal cord, but MRI of brain should be done in all cases.